Hi, I'm Dr. Eck from Bonita Dental Care and Marco Dental Care. Today I'm going to demonstrate why the Paralace and the LANAP procedure is the most predictable, easiest thing to do to treat periodontal disease and periodontal infection. If we look at teeth, two roots next to each other, the bone should come across flat and hit 90 degrees against the roots. When we have periodontal infections and periodontal defects, we end up with a gap between our tooth and the bone. So then our picture looks more like this. And then we end up with this gap here between the root and the bone. Okay? So if you've gone through periodontal treatment over and over and over again and it hasn't worked, the reason is because this gap that's here, our instruments do not fit into that space. So if we go in and do a deep cleaning, a scaling, okay, we can get, because your gums are sitting up here somewhere, right? So the gum bone's underneath. If we do a scaling, okay, a root planing or a deep cleaning, we can clean pretty much from here to here, okay? But all this gap down here, our instruments don't fit into. So that is left behind, and the bacteria in there is left behind, okay? So there's really only two ways to treat this problem. One is the old school traditional gum surgery, okay, where you take a scalpel, you move the gum out of the way. We see these defects, we take a drill and we essentially drill this bone down to the bottom of that defect. So we get rid of that defect, right? The old saying, getting long in the tooth, okay? Teeth appear very long after this. It's a resective process, okay? Then we suture everything back together and we're done, okay? Not a fun process, but for 50, 60 years, it was the best thing we had. You know, for the last 25 so years, we've had a laser procedure available, and what it does is rather than us have to move gum out of the way, drill any good bone or anything else, the laser is selective to dark pigmented things. The bacteria that create these infections have dark pigments in them. So if we stick the laser tip underneath the gum, it doesn't have to reach to the bottom of that defect. The energy from it gets absorbed by the stuff in that pocket, okay? So all the bacteria in that area gets cleared away, okay? So once we kill the bacteria that's there, then the body can regenerate bone to fill in that defect, okay? It's a regenerative process, okay? So this is the most predictable and easiest way to treat periodontal infection.